Hi and welcome back to 90 Day Dental Day 53. So we're cracking on with whitening and we've got one more session to go today on icon treatment for white spots, which is a heavily talked about topic normally, but especially so to round off the topic of whitening. And I've got the lovely Steve Conteh to give us a really detailed insight into this topic. Take it away, Steve.
So, thank you, Ahmed, for asking me to do this icon quick talk on white spot treatments using icon. This is really going to be just a quick overview and something I've rustled up in the last couple of days, just to give a quick overview on kind of a couple of cases I've treated, together with just a few key tips that I think are important. As I say, we're not going to go into great detail in this for 10 minutes, but if you're looking at trying to find more information on this, I'd point you in the direction of Richard Field, who did an amazing webinar. That was really good for Dental Update not too long ago, and also the direction of Linda Greenwell, and both of them have videos online and all sorts to really go into the ins and outs of this treatment. So a bit of background on this. So Icon's originally designed for the treatment of carious lesions into enamel. The carious lesion creates porosities in the enamel through the fermentable carbohydrates, thus changing the refractive index. So it was thought that a low viscosity resin, predominantly TEGDMA or 10DMA, could be used to infiltrate the porous enamel and halt the carious process. So that's what it was designed for, and essentially used for the treatment of non-cavitated lesions. And this diagram here sort of shows, in a sound enamel, the light will travel straight through, causing a certain optical property. When we have a white spot lesion, the light is dispersed within the enamel, and this gives it a different refractive index. In fact, the refractive index goes down from 1.62 to a 1.3 when wet, or to a 1 when dry. And then, if you can find an infiltrant with a similar refractive index to enamel, then you will hopefully change those light properties by letting this infiltrant enter the enamel. The light should pass through it as it almost did for sound enamel. And that's the kind of way that this icon works in terms of the optical properties. But as I say, it was first kind of designed to treat these sort of lesions here, non-cavitated, early enamel carious lesions. And you can see once treated, actually not only does it treat the caries, but it also improves the aesthetic of things. And that's just an example of what the interproximal device looks like posteriorly for applying the etch and the infiltrant. So it was discovered this infiltration of the enamel not only changed its physical properties, but changed its optical properties, and leading to the potential for this to be used as a resin infiltration in aesthetics in anterior white spot lesions, things such as fluorosis, the mild to the moderate, and also possibly used around orthodontic brackets. You get those carious lesions around the enamel. And I don't know, I've personally found, and some people also agree, that it's probably more effective for white spots. I'd go a bit further and say that maybe it was for the diffuse white spots as opposed to the really well-defined white spots. I just found that you probably get more success with those in terms of your 2 or 3 applications and actually dealing with the lesion. I think the more defined they get, and then the deeper they get, you're going to have some more trouble with just using icon, and you may have to pair that with a bit of microabrasion or megabrasion, and some composite bonding, and possibly even consider whitening in the first instance, particularly with your yellow-brown lesions. You probably want to do a bit of whitening first, and then see if you can deal with the rest of the lesion thereafter with a combination of icon and composite bonding. You may also lean towards doing just some mega abrasion itself and putting some composite bonding in there. It just depends on the situation and the tissue cost as well. So that just goes back to what we were talking about previously. But what we'll see here is this is what comes in the kit. So you've got the icon etch, which is the green etch here, which is a 15% hydrochloric acid. This removes superficial discoloration, and it also removes the mineralized enamel to increase porosity. This is what's going to enable your resin to infiltrate the tooth. Then we have the icon dry, which is this clear substance here, and that is the ethanol, 99% ethanol, I think it was, and it removes the water contained within the porosities. And this sort of starts to give you a kind of a preview of what the tooth will look like once you infiltrate it. But I'll come on to that later on. Then you have the icon infiltrant, and this is here in the black syringe here. And this is the TEG-DNA based resin infiltrant that will enter the tooth and has a similar sort of refractive index to enamel. So this protocol I put here is essentially just from the instructions. I kind of do this quite a lot with a number of instructions. We use a number of different materials, and they've got very specific timings and how do you use this. And I find it just helps to have this on a Google document, or you could print it and have it laminated in surgery, or just something to refer to. It helps you to know what you're going to do, when you're going to do it, how long you're going to do it for, all those sorts of things, and just makes life a lot easier. Difficult to remember all these things very specifically, so the easier it can be, the better. So the protocol, as it says, is you put some rubber dam, clean the tooth with some prophy paste, you apply your hydrochloric acid. You can do this they need to do it for 2 minutes per application. And so you etch the tooth for 2 minutes. Might help to have a timer to hand as well. And then you give this a wash, and you may find that with the more diffuse, more superficial lesions, they may start to go after a first application, but some of the deeper, more defined ones, you may need to do a few more applications. And so you've got to kind of visually assess this. And you can go up to 3 applications as you go. In terms of what you do after that, you go on to the ethanol. This is the Icon Dry, and you put this into the depth, soak it, and then give a 30-second air dry. And repeat this at least once to maximize the drying effect, so the ethanol can really clear all the fluids inside the tooth. After this, you can do a visual check, and this is where you start to see if you've gotten the changes that you were looking for in terms of getting rid of the lesion. The color of the lesion must change once desiccated, and that gives you an idea that you're going to get some successful infiltration of your resin. If you don't get that color change, you need to continue your etches. So once you've done this and you're getting that color change, you're now able to move on to the next step, which is applying your resin. And you apply lots of it, coat the tooth in this and leave it there to set for 3 minutes. You can agitate with an applicator to enable it to penetrate further. And you may extend this up to 6 minutes for those deeper defined lesions. Then you want to remove all the surplus on the tooth with cotton wool and floss the contacts. The reason being that this resin is not mechanically as strong as our composite restoring resins, so it's not really meant to restore the surface. So you want to remove all that surplus. You can put additional coats on of this resin, but really you don't want it to be your final coat on top. If you have a lesion where you've had to use some megabrasion or you've had to use some microabrasion, as I'll show you later, then you don't want to finish with resin on this, with this infiltrant resin on top. You want something more something mechanically durable enough to deal with the oral environment. So once you've done all this, you like your and then you go on to polish your enamel with discs and silicone polishers. And this video here, if it will play for us, will just be an example of that. So I'll play that now. This you can find on YouTube. It's just going to go through the step-by-step with a kind of video as we were talking about. This is by Marie Clements. As I say, you can find this online. And I think it just documents really well what you need to do. Getting rid of any of the enamel or the pellicle, any bacteria, plaque, food debris, anything like that. And then you're applying the etch, and really applying it to where those lesions are. You can agitate and rub it in with a micro brush, and then you just leave that in place really to do its work. 2 minutes. Give that a rinse. That's the Icon Dry being applied there. Now she's actually using syringes there. You do get an application tip that's sort of like a round brush to use with the Icon kit, but leave that to work. so there wasn't sufficient change in the appearance. So another application, you can go up to 3 with this. That's right. And we'll move on a little bit. So eventually it was sufficient to infiltrate. And so this is quite a handy thing, I think, here, using these separation sheets. Provided your lesions aren't exclusively interproximal, I guess, this is quite a good way to prevent you bonding the teeth together with just little mylar strips in between. And then, you know, you soak the teeth with this infiltrant, leave it for 3 minutes to really give it time to get into the tooth. Do additional applications, like curing that, and giving that a really good polish afterwards. You really want to get rid of any excess on the surface because it's not mechanically stable enough. It's going to pick up stain, it's going to roughen, it's going to chip, it's not going to be as aesthetic or durable as enamel or our restoring composites. So you get rid of that. And there we are, we've had a change there. So that was just a nice video that I thought would be good to share. So here's a case that I've sort of seen. She actually came in for a whitening consult, this lady. But what was found out from her, what we found out from her was actually she was unhappy with the white spots on the teeth, these little spots here. And her main aim, and it's always, I think, really important to get this aim from the patient, is, you know, what do you want to achieve from this? She just wants her teeth to be the same color. And so that's a really important thing to take forward with the options that we discuss and move forwards with. And so the close-ups here, you can see the outlines of these here on a few of the teeth. I'd say the centrals and the laterals are what are most affected by it. And so that's what we're dealing with in terms of, you know, what we want to treat here. Interestingly, her teeth were quite white already. She had whitened in the past, and you can see here in terms of the B1, she's not really far off that shade already. And so when asked further about, you know, if she was happy with the color of her teeth or she wanted to whiten, she said actually no, she doesn't want to. Whitening can be a good initial step in treating the lesions on these teeth, because it may well help to reduce the contrast between the white spots and the rest of the tooth. Not initially, by day 3 the white spots will go really white, but then eventually they should hopefully have a bit more of a blend, but not always. And actually with a patient like this who's happy with the color of her teeth and just wants them to be uniform, we didn't find a necessary need to have to whiten her teeth, nor did she ever want to whiten her teeth anyway. So that sort of guided our planning process for her. As we say, she wants teeth with the same color. The diagnosis I made was mild fluorosis, but also I think there's some demineralization around some previous orthodontic brackets. And I'll show you why I think that in a moment. But we agreed to do some resin infiltration, plus or minus some composite bonding if required. I noticed that these lesions, the outline was quite defined, so I knew they were going to be fairly deep, and, you know, just wanted to make her aware that if, you know, the resin on its own wasn't going to do the job, we may just roughen and take a few microns off the surface and add some composite resin there for her. And this is why I think there might be some orthodontic bracket demineralization, because you can almost draw the outline of where an orthodontic bracket would have been on this tooth. And so that just, you know, made me think maybe it is that. Perhaps, yeah, that was my thought on that as well there. So anyway, so isolate the teeth. By the way, these pictures will have a lot of muck in the lens. The lenses need a clean, it's got a few hairs in there and that sort of thing, but yeah, that's just how it is. And so in terms of the teeth here, we isolate first of all, and then we apply the etch to the teeth. Left this on for 2 minutes, just to try and remove a few things. However, when we finished that, we hadn't seen a real big change when we applied the icon dryers. We did another application of that, and still not getting a huge amount there. So at this stage, I thought actually I'll do a little bit of microabrasion. So I used a micro etcher, like the Danville ones or anything like that, and just took off a bit of the surface. Just did a little bit to help the penetration of the infiltrant. So you'll see these areas here. Just did a little bit of microabrasion and took off a few microns of enamel there. And then we're able to infiltrate. So we did our infiltration, and I used floss and cotton wool to remove the excess in this situation. Then, because of the areas where I had actually removed a little bit of enamel, what I went on to do was add some composite resin, just an enamel shade, microfill or something along those lines. Will do quite well for that. And you can see actually as well, just the effect of desiccation on the tooth. This area is a much different color to this area because the rubber dam didn't actually come all the way over. It was doing this. I didn't invert it all the way. There's a little bit of excess here as well, which I polished off afterwards as well in terms of the infiltrant. So yeah, those are a few flaws in the rubber dam, but we had enough isolation to do what we wanted to do for this case. And that's a few minutes later, just once things have rehydrated and we finished our polishing, and you can see the white spots. We actually kind of dealt with those quite well. Her teeth now are the same color, which is what she came in asking about. So we see the before and after there. And so for these sort of white spots, it can be beneficial. Perhaps if I'd done a few more applications or been a bit more patient with it, we could have maybe done it purely with Icon. But I think sometimes when they're really defined, those white spots, you have to do a little bit more than you may bargain for. But ultimately, it's still quite a minimally invasive treatment. Taking off a few microns to improve the appearance of the teeth is okay, and I'd be okay with that on my teeth if I had spots that bothered me this much on my teeth. And there we are. So that's the before and after for her there, and she's quite happy with that, which is good. And as I say, for these sorts of cases here, where you've got quite a deep defined lesion, I think these cases it's good to whiten first. You may remove some of this yellow around here. You may improve the contrast between the actual enamel and the tooth, and she could do with a bit of a prophy as well. So she went to see the hygienist, this patient. Then she had some whitening. And then for this case, we actually did a combination again of Icon and a bit of microabrasion of the surface, and just restored that with a bit of composite resin there. And ended up with a lovely result for her there. So yeah, really that's the overview on Icon. As I say, I haven't gone into great detail on any specifics. I think the key points I'd say is kind of diagnosis is quite important, knowing what kind of lesion you're dealing with, and therefore knowing what sort of modality you have to apply. These resources here were quite helpful. This sort of talks about some case reports where they treat far more severe cases than I've shown today. I don't know if I'm personally comfortable treating that kind of case relying on Icon, but they do show some impressive things in there. And these are a few of the papers you can have a little look at as well if you so please. So great, we'll call that a day, and thank you very much.
And that brings whitening to a close. It's been a great topic to delve into, hopefully quite relevant for a lot of people. And tomorrow we start a new one. See you then.